Welcome to our patient information video on tonsillitis. In this video, we will be covering what is tonsillitis, what are the causes, how is it diagnosed. We will cover the progression of the condition, highlight any symptoms, treatment options, long-term management, as well as provide other useful resources for more information. Okay, so let's get started. Tonsillitis is a common infection that causes inflammation of the tonsils. The tonsils are two small glands located at the back of the throat. They play a role in the immune system by helping to trap germs entering through the mouth and nose. Tonsillitis is most common in children, but adults can also be affected. It is usually caused by viral infections, though bacteria can sometimes be responsible. Most cases improve within a week, and serious complications are uncommon with appropriate care. Tonsillitis is most commonly caused by viruses, such as those responsible for colds and flu. Bacterial infections, particularly group A Streptococcus, can also cause tonsillitis. These infections spread through droplets when an infected person coughs, sneezes, or has close contact with others. Children, school environments, and crowded settings increase the risk of transmission. Having a weakened immune system may also increase susceptibility. However, tonsillitis can affect anyone, even otherwise healthy individuals. Tonsillitis is usually diagnosed by a GP based on symptoms and examination of the throat. The tonsils may appear swollen, red, or covered with white patches. The doctor may also check for swollen glands in the neck and assess overall symptoms. Tests are not always necessary, as most cases are viral. However, if a bacterial infection is suspected, further assessment may help guide treatment decisions. This image shows the difference between healthy tonsils and inflamed tonsils in someone with tonsillitis. The tonsils appear red, swollen, and may have white patches, which are common signs of infection. The main symptom of tonsillitis is a sore throat, which can make swallowing painful. The tonsils may appear red and swollen, sometimes with white patches. Other symptoms include fever, headache, tiredness, and swollen glands in the neck. Some people may also experience bad breath or ear pain. Medical advice should be sought urgently if there is difficulty breathing, difficulty swallowing fluids, or symptoms that are severe or worsening. Most cases of tonsillitis improve naturally within 3 to 7 days. Symptoms may gradually reduce as the immune system clears the infection. Without treatment, viral tonsillitis typically resolves completely. Bacterial tonsillitis may last longer but often improves as well. In rare cases, complications such as abscess formation can occur. Seeking medical advice is important if symptoms are severe, worsen, or do not improve within a week. Treatment focuses on relieving symptoms and supporting recovery. Rest, drinking fluids, and using over-the-counter pain relief such as paracetamol or ibuprofen can help reduce discomfort and fever. Antibiotics are not usually needed but may be prescribed if a bacterial infection is suspected. Most people recover fully without specific medical treatment. Following medical advice and completing prescribed treatments helps ensure proper recovery. Most people recover fully within 1 week. Rest, hydration, and symptom relief support recovery. Preventing spread involves good hygiene, including regular hand washing and avoiding close contact when unwell. Covering coughs and sneezes helps to protect others. Recurrent tonsillitis may occasionally require specialist assessment. However, most people experience full recovery without long-term effects. So in summary, tonsillitis is a common infection affecting the tonsils, usually caused by viruses. Most cases improve naturally within a week. Symptoms include sore throat, fever, and swollen glands. Treatment focuses on relieving symptoms, and antibiotics are only needed in some cases. Seeking medical advice is important if symptoms are severe or do not improve. With appropriate care, recovery is expected, and serious complications are uncommon. For trusted tonsillitis info, visit the NHS website for clear guidance on symptoms, causes, and when to see a doctor. NICE clinical knowledge summaries provide evidence-based tips for UK GPs to diagnose and manage it safely. Patient.info offers GP-written explanations on treatment and recovery. These UK resources help you spot symptoms, manage the condition, and know when to seek care. Thank you for watching our patient information video on tonsillitis. We hope you found it useful.